use is worth the squeeze. And for me, it has not.
I saw this video from Dr. May, and I find her whole account very interesting because she's talking about something we don't talk about a lot in medicine. What happens if you get very far down the path of a certain specialty and just don't really love it? Medical training is very unique in how we do things. So you don't just get your doctorate, which all doctors have, our MD or our DO. After that, you do training, you do a residency program. Now, these residency programs kind of lock you into a specialty, and they take many, many years. And it's very common for people to have a rough time the first couple years and feel pretty miserable. And it can be difficult to determine whether the misery is just the training in general or you just really don't like the specialty. And herein lies the problem. Once you're a couple years in, you can't just hop specialties. So you can't start out in surgery, not like it, and just switch over to anesthesia same year. You often have to repeat multiple years, which is something people don't want to do, obviously. The first time I encountered someone who felt this way, I was a second-year general surgery resident in the ICU, and our fellow that year was doing a surgical critical care fellowship because she just didn't like surgery and didn't want to do it. And she told me that every single year, she expressed to her mentors that she just didn't think this was for her. She didn't enjoy it. And every year they told her the same thing. They told her, it'll get better. It gets better every year. And it just didn't. And they kept saying that until she was completely finished with general surgery 5 years in. And then what do? And the comments are a little bit crazy on some of her videos. People have this idea that since medicine is difficult to get into and certain specialties are difficult to get into, that we should be so grateful we're in it that we should tolerate any treatment from patients, any time schedule you force us to work, and be excited about it. And that's just not the reality. I can recognize as a doctor it is a great privilege to care for patients, but still want to protect my mental health and my personal health. People just expect too much from us, and the way our training is set up, we don't have an out once we get down the path, and it's really unfortunate. People always perform at their best when they're treated with respect and they live a happy and well-rounded life, and that's true for doctors as well as everybody else.